In 2021, there were 48.3 million denied claims, accounting for 16.6% of all claims submitted that year. But this doesn't mean that the denied claims are evenly distributed across the board. When it comes to in-network claims, insurer denial rates range from 1% to 80%. If you are a healthcare provider, you likely deal with denied claims regularly. Of course, receiving them doesn't mean you should lose all hope. In most cases, you can appeal them, but that still requires a lot of effort. Hi everyone, I'm Elia from eTactics, and today I'm going to talk about the rising number of health insurance claim denials. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so that when we post new helpful content, you get notified. Health insurance claim denials are rising. From 2016 to the beginning of 2020, the average denials rate increased by 20%. By the end of 2020, the total increase sat around 23%. Part of this is because the rate naturally increases over time. But even so, the percentage of denied claims increased exponentially due to the 2020 COVID-19 pandemic. To illustrate this, in 2016, the average rate of denied claims sat around 9% of all claims submitted. By June 2020, while the crisis point of COVID-19 pandemic, the average rate was 10.8%. By quarter 3 of 2020, the average rate hit around 11.1%. To make matters worse, 30% of people who responded to Experian Health's survey say that denials are increasing between 10 to 15%. Why are they rising? The three primary reasons according to Experian data are data analytics, lack of automation in the claims and/or denial process, and lack of thorough training. In truth, healthcare providers lack experienced resources that help prevent denials. This is especially true in complex clinical cases. They lack the expertise to support appeals and data for root cause analysis. Staff attrition and training are also a problem. With a tight labor market, hiring and retaining qualified staff members becomes harder and harder. The complexity of denials requires robust training and education programs. Unfortunately, companies oftentimes don't have the time or the resources to follow through. It's a requirement for clinical staff to manage clinical denials. But when overwhelmed by patient care, claim management falls to the wayside. It also doesn't help that there's a growing backlog of denials. Peak seasons and staffing challenges expanding lead to such workflow bottlenecks. With timely filing deadlines, many of these aren't filed in time and end up in the denied pile. Many healthcare practices focus on remedying individual denials instead of analyzing the root causes. Not only does this continue the cycle of producing denials, but it also fails to reduce the volume of current denials. If you'd like to learn more about medical billing denials, reach out to eTactics. And you've already made it this far into the video, so you might as well like it, share it, and comment below.